So let's talk about rhinoplasty. Rhinoplasty is a procedure where we change the structure of the nose. Oftentimes people have noses that are too large, too small, and they want to change the appearance of the nose, and through this procedure we're able to do that. In addition to having aesthetic issues with the nose, however, sometimes people also have functional issues with the nose where they're not able to breathe properly. And so with this procedure, we can also correct any functional issues associated with breathing difficulties. So how do we do rhinoplasty? Well, of course, that's patient independent, right? So people have all different kinds of issues that they come with when they're seeking rhinoplasty. Some people, believe it or not, have noses that are actually too small. They want to make the nose a little bit larger, particularly patients who are of African American descent or Asian descent. Oftentimes the bridge of their nose is actually too small and they want to augment that. So one of the ways we do that is with different types of grafting techniques, we're able to augment the size of the nose. Those same populations of people often have sort of broad and bulbous tips, and sort of the base of the nose can be kind of wide as well. And so we perform steps in the procedure that help to narrow and refine those things. Now that's very different than what is probably more the standard type of patient, where rhinoplasty is actually a reductive procedure. And by reductive procedure, what I mean is that of course we're making the nose a bit smaller. So the most common scenario that people think of with rhinoplasty is someone who has sort of a large over projecting nose. Oftentimes the tip is sort of drooping down, and what we do is we reduce the height of the dorsum. We try and make it nice and straight on the profile view, and then we also typically elevate the tip and use tip refining maneuvers to make the nose just fit more harmoniously with the rest of the face. So who's a good candidate for rhinoplasty? Patients who are unhappy with the size and shape of their nose. So if you have a nose that is too large, of course we can correct the shape by reducing the size of the nose. If you have a nose that's too small, we can also augment the nose and make the nose more harmonious with the rest of the face. In addition, patients who have functional issues with their nose, with breathing, are also good candidates for rhinoplasty.